lot of people have been asking, what is it like to start as a junior doctor during this COVID-19 pandemic? Is it scary? Well, there is an element of fear, but in a way it's also a privilege because we study so hard to graduate as doctors and to serve. And what better time is there to serve than during a pandemic?
The shift is about 12 hours. So it's 8 o'clock it's 8 a.m. to 8 p.m. Normally we will be in the full PPE, meaning the protective equipment. So we will be wearing glasses. Usually I tape down my glasses because my glasses will fly everywhere and we cannot touch our face to adjust our glasses. After that we will wear goggles as well as the N95 mask on top of a lot of other protective equipment like the gown as well as the hairnet.
I'm currently working in pediatric medicine in KK Hospital, where day to day I get to interact with children and their family members. It is definitely a different experience working pre-COVID-19 and currently in the midst of COVID-19, as day to day we will have to adapt to different workflows and adapt to different rostering to the various wards that cover either the COVID-19 patients or the non-COVID-19 patients.
There have been some tough times in the emergency department itself. Some days when the queue is really long, at NCID especially. When we first see them in the emergency department or in NCID, the main concern for them is always like what is going to happen next, in terms of being very clear in explanation about what is going to happen as the days go on, regardless of whether their result is positive or negative. So to give them a whole overview and a whole picture of what will actually happen.
For the first month of work, we will not be allocated to any COVID-19 ward so as to allow us to get used to house officer work before we actually go towards seeing patients who are suspected for COVID-19.
Firstly, I would like to talk about the people, which I think were an integral part of my experience in LKCMedicine. We cannot forget the clinicians. I thought that they were all very personable and very approachable, and I think that, apart from the skills that they tried to impart to us, which were very valuable, I think them being personable really helped me to see what kind of person I could actually become after so many years in this line. We had really good role models.
LKCMedicine has prepared me for a career by placing an emphasis on the softer skills of patient interaction. There are many opportunities to interact with patients, both simulated as well as real life. And that gives students the opportunity to find out what helps them become better listeners.
The most important lesson that I took away from LKC was emphasis on communication skills, making sure that everything that we did would have been communicated to our patients and their families, as well as to our allied healthcare staff, to minimize any errors, minimize any misunderstandings and miscommunications that could have led to patient harm.
I'm thankful for the lessons that LKCMedicine has taught me. First, the spirit of camaraderie and community, to be there for each other and to be there for our peers. And secondly, the integrity to do the right thing for our patients, even if it means going the extra mile.
LKCMedicine has prepared me for working life is the fact that we did have quite early on clinical exposure, and we had quite targeted sessions during our medical school itself to help us deal with certain difficult situations. We did have dedicated sessions in schools to train us on how to break bad news, what is the appropriate techniques to use, which actually makes it much easier in real life.
First of all, I'd like to congratulate all of you for making it thus far. Continue to hold on to the reason why you want to become a doctor, because that would bring you through the more difficult times.
Medical school can be tough. All I can say is work hard, play hard. There's a lot of studying, but at the end of the day, when you are able to take care of your own patients, it will be worth it in the end.
I would advise to try to get a strong network of friends that can support you through this journey. I wish you guys all the best, and I hope to see you someday in the wards.